Outside New York, people are lined up at this drive-up clinic offering free coronavirus tests.
There's a lot of fear around, and no one is really sure what to do.
It is a failing. I mean, let's admit it.
Today, one of the nation's top health officials described the system bluntly.
The idea of anybody getting it easily, the way people in other countries are doing it, we're not set up for that. Do I think we should be? Yes, but we're not.
That directly contradicts President Trump.
Frankly, the testing has been going very smooth.
South Korea, for example, says it's testing 10,000 patients a day for COVID-19. The U.S. is nowhere near that number.
Why not?
Well, from early on in this effort, we've been addressing the testing issue.
Vice President Pence now says every state-run lab in the U.S. can test, but critics are asking what's taking so long. The American Clinical Laboratory Association says private labs and hospitals asked mid-January about developing their own tests, but the federal government didn't issue new rules speeding up the approval process until late February.
This is a new challenge, not only for our country but for the world.
Today, the Cleveland Clinic started on-site COVID-19 testing with results available within 8 hours.
Will that save lives?
It will. It will save lives because it is going to give us a faster and a better understanding who are the patients that we need to keep at home.
The Cleveland Clinic says it's one out of only about a dozen hospitals across the country that are doing on-site testing. Lester?
All right, Gabe Gutierrez, thank you. Now to the pandemic overseas. The new center of the coronavirus storm is in Europe. Here's Chief Foreign Correspondent Richard Engel.
The CDC tonight says Europe is the new epicenter of the epidemic, with 70% of new cases originating here. And countries are falling like dominoes, one shutting down after another. Ireland reporting its first coronavirus death, now closing schools. The Irish Prime Minister today with President Trump.
We need to do this for a couple of weeks to make sure the virus doesn't spread.
In Italy, the death toll rising over 1,000. Officials already banning most public gatherings and ordering a 3 feet separation in public. NBC's Matt Bradley is there.
Every shop and business in this country shut down, including iconic Italian brands like Gucci. Only grocery stores and pharmacies are allowed to stay open.
Shaking fewer hands.
Canada's Prime Minister Justin Trudeau announcing he will self-isolate after his wife got flu symptoms after a trip to the UK. And in Germany, Americans are struggling to get home.
I feel like there's a lot of panic and I don't really know.
The one place that seems to have passed through the worst of the virus is China, where it first broke out in December. The last patients were discharged from hospitals China crash-built. China used the full force of its one-party state to contain this virus, including locking down Wuhan, a city of 11 million people.
It did work, but it was extremely draconian, and I just don't know that we need to be quite that aggressive.
And how long the peak outbreak might last in the States, experts tell us weeks or maybe months.
Another question many Americans are asking: how do you know when to stay home if you think you may have been exposed? We get more on that from NBC's Stephanie Gosk.
Slow the virus down. That's what health officials say will be key in the coming days.
We're asking to self-quarantine for 14 days.
Self-quarantine for 14 days.
Self-quarantine.
Self-quarantine.
So-called self-quarantine is one way to do it. Separating yourself from others voluntarily for 14 days to see if symptoms develop. The CDC advises people consider taking action if they have been exposed to someone who tested positive. At work, that could mean someone who sits 6 feet or closer, a colleague you interact with regularly, or a friend you've recently had dinner with. But guidance is confusing, and for now, if you're not showing symptoms, it may be a personal judgment call. Taking this step is disruptive, not going to work, staying at home, and keeping distance from friends and family. Make sure not to share dishes, towels, or bedding. Homes should already be stocked with necessities, toiletries, food, prescription, and over-the-counter medications to last up to a month. Going outside for a long walk or bike ride may actually be okay. Going to stores and coffee shops is not, because there are too many people. In the end, it is a difficult step to take with a selfless goal, protecting others. Stephanie Gosk, NBC News, New York.